The discovery of penicillin, one of the most transformative events in medical history, was a serendipitous breakthrough that occurred in 1928. This chance finding by Alexander Fleming led to the development of the first true antibiotic, fundamentally altering the treatment of bacterial infections and setting the stage for modern medicine. This extensive account delves into the historical background, the discovery process, subsequent challenges, and the widespread impact of penicillin. Historical context: pre-penicillin medical landscape. The state of infectious diseases in the early 20th century, bacterial infections were a leading cause of death worldwide. Conditions such as pneumonia, tuberculosis, and wound infections often resulted in fatal outcomes. Prior to penicillin, treatments for bacterial infections were rudimentary and largely ineffective. Surgical procedures carried a high risk of post-operative infections, and antiseptics like carbolic acid, while helpful in preventing infection, did not treat the infections once they occurred. Scientific understanding and advances. Early microbiological research. The late 19th and early 20th centuries saw rapid advancements in microbiology. The germ theory of disease, proposed by Louis Pasteur and Robert Koch, revolutionized the understanding of infection, highlighting that microorganisms were the causative agents of many diseases. This discovery paved the way for the search for substances that could target and destroy bacteria. The era of chemical research. During this period, researchers were exploring various chemical compounds for their potential antibacterial properties. Although there were some successes, such as the development of sulfur drugs in the 1930s, no truly effective antibiotics had been discovered by the time Fleming made his groundbreaking observation. Alexander Fleming, the scientist. Early life and academic journey. Alexander Fleming was born on August 6, 1881, in Lockfield, Scotland. He studied medicine at St Mary's Hospital Medical School in London, where he developed an interest in bacteriology. Fleming's early research involved studying bacterial cultures and exploring ways to combat bacterial infections. The experimental setup. Fleming's laboratory work. In 1928, Fleming was conducting experiments on Staphylococci, a type of bacteria known to cause infections. His laboratory was cluttered with petri dishes containing bacterial cultures, many of which were inadvertently left uncovered. Fleming's research was focused on finding an effective antibacterial agent. The accidental discovery of a moldy petri dish. Fleming's discovery began when he returned from a 2-week vacation and noticed a petri dish with a mold growing on it. Surrounding the mold, he observed a clear area where the bacteria had been killed. This mold was identified as Penicillium notatum, and the clear zone around it indicated the presence of a substance capable of killing bacteria. Fleming named this substance penicillin. Initial research and challenges characterizing penicillin. Fleming's initial experiments demonstrated that penicillin had the ability to kill a wide range of bacteria, including Staphylococcus and Streptococcus. However, isolating and purifying penicillin was a complex task. Fleming's lab-scale methods produced only small amounts of penicillin, which limited his ability to conduct further research and practical testing. Challenges in production scalability. Issues. The production of penicillin faced several obstacles. The mold grew slowly, and extracting sufficient quantities of penicillin proved difficult. Fleming's work was constrained by the lack of advanced techniques for large-scale production. Despite his efforts, penicillin remained more of a laboratory curiosity than a practical treatment. The role of World War II. The global need for antibiotics. The onset of World War II created an urgent need for effective treatments for bacterial infections among soldiers and civilians. The war highlighted the limitations of existing treatments and intensified the search for an antibiotic that could prevent and treat infections on a large scale. The breakthrough: mass production. Florey, Chain, and Heatley's contributions. The critical advancement in penicillin's development came through the efforts of Howard Florey, Sir Ernest Boris Chain, and Norman Heatley at the University of Oxford. In the early 1940s, they built upon Fleming's discovery by developing methods to produce penicillin in larger quantities. Florey and Chain, along with Heatley, faced the daunting task of scaling up production to meet wartime needs. Developing fermentation techniques. Florey and his team refined the fermentation process, discovering that using larger fermentation tanks and optimizing the growth medium could significantly increase penicillin yields. The use of corn steep liquor as a nutrient source was a key innovation that allowed for higher production volumes. This development was crucial in making penicillin available in the quantities required for widespread use. Industrial production and distribution, government and industry collaboration. The successful mass production of penicillin was a collaborative effort involving the British government, the US government, pharmaceutical companies, and scientific researchers. The US government, recognizing the strategic importance of penicillin, provided substantial funding and resources to accelerate its production. The large-scale production facilities in the United States played a pivotal role in manufacturing penicillin during World War II. Penicillin's impact on World War II life-saving treatment. Penicillin's introduction during World War II had a profound impact. It drastically reduced the incidence of fatal infections and sepsis among wounded soldiers. The drug's effectiveness in treating bacterial infections contributed to a significant decline in mortality rates, demonstrating its potential to save lives and improve recovery outcomes. Post-war impact and legacy. Revolutionizing medicine. The success of penicillin marked the beginning of the antibiotic era, transforming medical practice and providing new tools for managing bacterial infections. The principles established by penicillin's discovery led to the development of other antibiotics, such as streptomycin, tetracycline, and erythromycin, which expanded the range of treatable diseases. Antibiotic era and challenges. The emergence of antibiotic resistance. The widespread use of antibiotics, including penicillin, has led to the emergence of antibiotic-resistant bacteria. This phenomenon presents a significant challenge for modern medicine, as resistance threatens to undermine the effectiveness of available treatments. The problem of antibiotic resistance underscores the need for continued research, the development of new antibiotics, and prudent use of existing drugs. Legacy of the discovery. Scientific and medical influence. Fleming's discovery of penicillin is a landmark in medical history, illustrating the importance of observation, curiosity, and the potential for chance discoveries to drive scientific progress. The development of penicillin not only saved millions of lives but also laid the groundwork for future innovations in drug development and medical treatments. Ongoing research and future prospects. Advancements and innovations. The principles behind penicillin's discovery continue to influence modern research and drug development. Scientists are exploring new antibiotics, alternative treatments, and strategies to combat antibiotic resistance. The legacy of penicillin's discovery serves as a reminder of the transformative power of scientific breakthroughs and the ongoing need for innovation in medicine. Conclusion. The story of penicillin's discovery is a remarkable journey from an accidental observation to a revolutionary medical breakthrough. Alexander Fleming's chance finding, coupled with subsequent research and development efforts, led to the creation of a life-saving drug that transformed the treatment of bacterial infections. Penicillin's impact on medicine, its role in World War II, and its enduring legacy highlight the profound significance of scientific discoveries in shaping the course of human health and well-being.